I want to introduce my next guest, who is a fellow ketogenic dietitian. And you've heard about how ketogenic diets work with hormones later in life, but what about with fertility? What about the younger years? So motivated by her own journey of reversing PCOS, losing 40 pounds, and getting pregnant naturally after being told she couldn't, Temple Stewart has, you guys, if you're not following her on Instagram, you have to follow her on Instagram because she has the best, most fun account. And as I mentioned, she's a registered dietitian. She recently moved her family from Florida to Arizona. She's starting medical school on Monday to be a naturopathic doctor. Super excited for her. Please welcome Temple Stewart.
I've never walked up to music before, so that's kind of fun. My name's Temple, like Kristina said. I've been a private practice dietitian for 2 years now, but I got my start in clinical dietetics. If you guys haven't picked up on kind of the dietitian lingo around here, keto isn't super friendly to, our dietitians aren't super friendly to keto. You know, there's several dietitians, Kristina being one of them, but so it is my mission in life to change that. So that's part of the reason why I'm here. That's part of the reason why I'm so passionate about coming to these conferences, is because I think keto has a huge place, and I think there's a huge part of dietitians taking back this field. So that's not really relevant to PCOS, fertility, and keto, but that's my little spiel on that. So anyway, what I'm talking about today is PCOS, infertility, and keto. So everybody's done it. So I want to see a show of hands. Who has had someone either in their family, maybe your own journey, anything related to infertility in their life? Could y'all raise your hand? Yeah, several of us, right? It's really impactful. And the sad thing is, guys, is it's not going away. If you look at birth rates, if you look at women having children, it's less and less, and that it's really sad. And so that's part of the reason I'm here. So let's get into it. We're going to go through the background. We're going to talk a little bit about PCOS, obviously insulin resistance, inflammation, and then I'm going to make a case for keto and practical application. So this was me. This was while I was a student dietitian. I was almost 200 pounds. I had acne, no period, oily skin. I was super anxious. I was doing all the things I could think of, right? I was over-exercising, eating low calorie. I was in dietitian school at this time, right? I was doing everything they said. I was eating whole grains, lots of beans, following my plate, and I was miserable. I had just gotten married. You can see my adopted daughter here. She's lounging, having the time of her life, but I was struggling. I couldn't get pregnant. I couldn't figure out why. I didn't know what was going on. At this point in my life, I had completely lost my period. I had no clue. And I was frustrated. I had been a student athlete, a Division I athlete playing soccer, and I could not figure out why I was losing my health. I was gaining weight. I could not figure out why. So I walk into an OBGYN office and get my blood work done. Not one mention of blood sugar, not one mention of insulin resistance, not one mention of insulin or inflammation, and I was told, you have PCOS. I was told, you need to go on birth control, right? And here's metformin and spironolactone. And I was so confused. I was like, what is PCOS? I've never heard of this, you know, and as a student dietitian, I'm thinking, is there a food option? Is there a lifestyle option? What can I do to change the trajectory? And the next thing out of his mouth was, no, you've got this for a lifetime. PCOS isn't something you can change. This isn't something you can reverse. Your fertility journey is going to be a challenge. The next thing out of his mouth after that was plan to save money because, you know, the fertility treatments aren't cheap. And at the time I was 21 years old, I'm 27 now, and you know, that's really disheartening. You just married, you know, I wanted to be a mom. I had all these dreams, aspirations. I was a student, and I could remember just thinking, leaving his office, wow, that was a terrible experience. And I remember that just lit a flame in me, and I was determined to, one, figure out what was going on in my body, figure out what was going on with my hormones, and not accepting the fate that I was going to be on medications, and not accepting the fate that I was doomed to not having kids naturally. And so this was me. And then shortly after this, how many of you guys have heard of VirtaHealth? Has anyone heard of VirtaHealth? Yeah, so Virta Health did a study. So this was while I was in clinical dietetics. Virta Health did a study at the hospital that I was working at. Virta Health is incredible, by the way. I think they do incredible research. And I was watching these type 2 diabetics who had also been told the same things. You can't reverse type 2 diabetes. You're not going to get off your insulin. You're not going to get off the metformin. You're kind of doomed to medication for the rest of your life. Been told the same things that I had just been told. Reversing all that, losing 80, 90, 100 pounds. And they were reversing it. So there's got to be something to this keto thing. Now, mind you guys, I had never been told one thing about keto in dietitian school. Not one thing, right? We're the nutrition professionals. Why have we not been taught anything about keto? It was shocking. It's shocking. I went to a good school, University of Tennessee. Not one thing, I shouldn't have called them out like that, but not one thing about keto. And so I tried it. And so that happened. That little baby is a product of keto. And, I didn't have to, oh, that was sweet, thank you. So I didn't have to do birth control. I didn't have to do metformin. And no shame on anyone who has to do IVF or Clomid or any, I think it's incredible technologies that we have in the medical field. But I want to give people hope in the fact that there is diet and there is lifestyle changes that you can implement before not having to go down that route and having to spend that money, or even having, IVF isn't for the faint at heart, right? It's a lot of hormonal injections. It's not easy. And so that is a product of diet and lifestyle change and just being educated and just learning something that I had no clue was there. And so resistance training, obviously that helps a ton, and keto dieting through the education of Virta Health. I had no issues with breastfeeding. A lot of times women with PCOS, and we'll get into this a little bit more, have issues with breastfeeding. A lot of times women with PCOS will have issues with just not only conceiving naturally, but carrying the child through term. A lot of women with PCOS have issues with miscarriages and fetal development, all kinds of stuff. So anyway, I hope that gives somebody hope. And if you have someone in your life that has PCOS, I hope that you can share that message with them. So PCOS itself is the #1 leading cause of female infertility. Now, PCOS is a little bit like prediabetes. A lot of people have it and don't know it. So we have a lot of statistics on PCOS. We know it's very, very prevalent. We know it's very, very common. We know a lot of people go undiagnosed with PCOS until they start having problems. Now, some PCOS is very, very obvious. So you can see it on a lot of people. Some people have lean PCOS where you can't necessarily tell that they have it. Others, it's obvious, like I said. It is the most common endocrine disorder in females. So it involves multiple organ systems. When people, and a lot of OBGYNs will describe it to you, they only talk about the ovaries. Oh, you have cystic ovaries, that's kind of what it involves. It's a full body issue. It's a metabolic issue, and that's oftentimes left out when it's described. It was for me at least. I didn't understand it was a whole metabolic process. The symptoms for PCOS are what is particularly terrible, so especially for women. So because of the androgenic activity of PCOS, which we'll get into as well, it causes a lot of issues in terms of female hormones. So you're going to get a lot of male pattern baldness, so women will lose a lot of hair. They'll get hair in places that they don't want it, so they get a lot of facial hair. You'll get really, really oily skin. You'll obviously have a lot of issues with your period. You'll either lose it altogether or it'll be really spaced out. It could be really close together. It could be really heavy. It could be really light. It's all over the place. Like I mentioned, the androgens are very, very high. Acne, hirsutism, that's just the male pattern bald, or the extra hair that I was talking about. And then obviously the cyst on the ovaries. Now, I want to put up the diagnostic criteria for PCOS because even though you're diagnosed with PCOS, I want to just let people know it's reversible, like a lot of things. So the Rotterdam criteria, this one here on the bottom, is what is most commonly used. Hyperandrogenism is the extra testosterone and male hormones. Menstrual irregularity and cystic ovaries is the third one. Basically, you just have to have 2 out of 3 to be considered PCOS diagnoses. Now, if you take those away, would you consider that reversed? Yes, right? And so when you bring down the levels that we're talking about, you can reverse these. So typically, in what my OBGYN, once I found a great one, and you can find ones that are great, like Dr. Quebeca, Dr. Kiltz, that would have the same kind of thoughts, but you can pull these levels down at where you're no longer classified with these types of symptoms. So health risk associated with PCOS, and you'll notice the same health risk associated with high levels of insulin as well. So anovulatory cycles, just meaning you're not ovulating. Infertility, obviously. Pregnancy disorders, so a lot of women with PCOS will develop gestational diabetes, they'll get hypertension through their pregnancies, lots of fetal concerns, miscarriages, cardiovascular disease, non-alcoholic fatty liver, sleep apnea, tons of mental health issues throughout the pregnancy, and after 50% of women with PCOS will develop diabetes before they're 40, which is pretty shocking. Metabolic syndrome, obesity, all of it, which all really correlates with insulin, and we'll see that here in a second. Now, polycystic ovarian syndrome, and really this kind of goes across the spectrum. Weight and metabolic health often determine the severity of disease. Now, you don't see this all the time. I don't want to put people in a box, but oftentimes as weight increases, so will the severity of the disease. And the same thing is classified with PCOS. So oftentimes, and women get trapped in a really pretty horrible cycle with PCOS, because as insulin goes up, so does some of the cravings, so does the binging cycle, so does the problems with eating, and it becomes harder and harder to control your weight with PCOS. So you can see the severity of the problem gets higher and higher. So these women have a harder and harder time conceiving as they gain more and more weight, and the problem just becomes harder and harder and more magnified. Now, again, you can see this happen in all types of diseases. Diabetes, blood sugar gets worse and worse and worse. Hypertension, high blood pressure goes higher and higher and higher. You can see this in cancer and all kinds of different types of disorders. So let's talk about the links, and I'm sure you guys aren't going to be shocked about these. Insulin resistance. So many women, now I'm not saying all, because there are genetic links and other types of links, birth control usage, etc. But a lot of women with PCOS, it's linked back to insulin resistance, and I would go as far as to say the majority. Too much insulin inhibits aromatase. There's no estrogen spike to signal ovulation, which builds up and retains the eggs in the ovaries, right? And that's going to cause problems down the line. High insulin also causes the ovaries to make excess testosterone. Again, here's this right here. More than 50% of women with PCOS will be diagnosed with type 2 diabetes by the age of 40. Which, again, this is really shocking statistic, and oftentimes in my private practice, I'll have women that are already past the age of reproduction that have been on birth control for years and years and years and have said that they've been diagnosed with PCOS, wasn't really explained to them what all it meant, are now type 2 diabetics and never really understood the metabolic consequences or what they were supposed to be doing diet-wise, and are now trying to kind of reverse the damage done that could have started 25 years ago had they known what they were dealing with. All women with PCOS should be tested with a blood test, such as fasting insulin, HOMA-IR index, or 2 hours glucose challenge test. Often we don't see this happen. I think some of the biohacking technologies that we have nowadays are really helpful for women with PCOS. They show it real time. Several people have mentioned the Keto Mojo. Obviously, we can get women that have insulin-resistant PCOS on a low carbohydrate diet and lower that insulin. That can help them ovulate, and we'll see that here in a second. But even just showing them their blood glucose levels in real time, I put a lot of my clients and women with PCOS on, give them a CGM so that they can see what their blood glucose levels are doing. They can see that in real time, and that oftentimes will help women make good choices in regards to their food. Now, men, you are not excluded in the fertility conversation when it comes to insulin resistance. Insulin resistance is not good for men either. It lowers your testosterone, it decreases your sperm motility and sperm quality. So I don't want you to be excluded from this conversation either. And then inflammation. Women with PCOS and idiopathic infertility oftentimes have high inflammation as well. So you can see the inflammation HSCRP markers for PCOS and idiopathic infertility is oftentimes very high in these women as well. So you can see some studies here too. Women with PCOS exhibit elevation in circulating CRP levels. Inflammation impairs oocyte quality and causes anovulation and impacts hormone production. Is oftentimes associated with endometriosis. That's a whole nother conversation we could get into as well. And studies properly matched for BMI, CRP, PCOS was increased by 102%. CRP was, excuse me. Inflammation directly stimulates ovarian androgen production. And I keep mentioning androgen. Androgens, when they're backed up like this is what's causing all of this excess testosterone. That's ultimately what has caused all of these symptoms of the missing cycles, the excess hair, the baldness, the oily skin, and ultimately the symptoms of all of this. So that's essentially what we try to lower by lowering inflammation and insulin. Weight gain and increased BMI increase the inflammatory load. Again, weight and inflammation and insulin resistance all increase the severity of these things. Diet interventions in PCOS, another thing that I was not taught becoming a dietitian. A 2021 systematic review of random control trials showed that dietary interventions improve PCOS. Specifically, low carb is superior for fertility and normal menstruation. Oftentimes, I'll get women with PCOS or idiopathic infertility that come to me, and within 2 months, their periods have either returned if they have been missing or will return to normal within 4 to 6 months. It's really shocking how quick you can get people back ovulating. Indicate a higher pregnancy rate, which is incredible. Lowers the miscarriage rate, which is, I mean, obviously we don't want to talk about the trauma of that, but that's a huge stat. Improves ovulatory cycles, lowers the free androgen index, again, improving the symptoms of these disorders. Improvement in sex hormone binding globulin, lowers total testosterone levels. For women, that's a good thing if they're having excess testosterone. So the diet solution is a well-formulated ketogenic diet. Now, obviously, we've been here for a day and a half now. We know there's a lot of different methods to the ketogenic diet. We have the carnivore method. We have an alkaline ketogenic diet, lots of leafy greens. There's a lot of different ways. Ultimately, my method is what the individual can follow consistently and what they can do and what's most realistic in their lifestyle and what fits them best in that moment, and or if they're working with any other health-related conditions or what they've got going on. But lowering carbs, getting them in ketosis, lowering those blood sugar levels is ultimately going to be what is going to help them either conceive if that's their goal or just get rid of the symptoms that's causing all the problems. Keto for insulin resistance, so you can see a lot of these different studies here, and I think this is a good area for more studies and improved research. But you can see 2005 study, the ketogenic diet improved insulin sensitivity approximately 75%. This is obviously not PCOS specific, but if we know insulin resistance is causing a lot of these problems, we know it helps. You can correlate it. Decreased BMI, prevention, you can see the lipid panels increased or improved, decreased testosterone, comparison with low-fat diets, which most of what I learned in dietetic school is related to low-fat diets. We just listened to Nina's speech with her book is incredible, by the way. If you haven't read it, you should. That is most of what I was taught and what I was taught to teach. And women that are trying to conceive, not only is fat crucial for hormones, but so is protein. 9 times out of 10, if you're following the low-fat diet, you're probably not getting enough protein because you're eating too many carbohydrates. And so in comparison with low-fat diet, the ketogenic diet improves triglycerides, HDL, blood glucose, and insulin sensitivity. So you're getting a wealth of improvement there. In a study of keto versus conventional pharma for PCOS, keto showed better decreases in blood sugar, weight, and improvement, which is no shocker given all the other improvements. Again, more improvements. Reducing carbs helps lower insulin. Again, back to some of the hunger and food behaviors in PCOS. When you have constantly up and down blood sugars, especially in PCOS when they've already got so much hormonal dysregulation, the food behaviors are really hard. We heard Dr. Tro speak on this as well. A lot of women with PCOS have disordered eating, partly because of food behaviors, but a lot of that is hormonal issues as well, causing a lot of cravings, causing a lot of need for carbohydrates. And so getting those blood sugars stabilized, getting that insulin stabilized is going to help them be back in control over food. So again, helping them eat either less or eat less of the bad foods that are causing some of that blood sugar up and down. Keto low carb consistently outperforms low fat diets over and over and over again. I don't need to say that again. In PCOS, the study showed better biochemical markers in all of your women's reproductive hormones and insulin sensitivity. And again, back to the androgens, over and over again, helps decrease it. Keto for inflammation, very anti-inflammatory, done correctly, if done again for your genes, like Kristina was talking about. The ketogenic diet helps lower inflammation versus via antioxidant, multiple antioxidants mechanisms, reduces oxygen species. A well-formulated ketogenic diet contains fatty fish, lots of protein, animal proteins, eggs, organ meats, etc. Leafy greens, mushrooms, peppers, etc. Weight loss obviously is anti-inflammatory. So if you're taking a woman who is overweight, obese, and you help her lose weight, help her get control of those food behaviors that are causing her to eat inflammatory foods, you're going to see good response. Now, practical applications, obviously, get you a doctor like Dr. Kebeka, Dr. Kiltz to help you out, or see your MD, OB before changing your diet. Follow a well-formulated ketogenic diet for individual needs, focusing on anti-inflammatory needs. And I would also add in choosing high-protein animal foods and switching it to that method. Consider myo-inositol, diet-inositol. All of these supplements can be really helpful as additions. And I emphasize the word supplements because, again, they are supplemental to the diet, right? Supplements are always supplemental. You've got to change your diet first. There are some helpful medicinal herbs for fertility as well. Aloe vera, cinnamon, green tea, chamomile, white mulberry, spearmint tea, licorice root. There are some homeopathic methods that have proved helpful as well. Y'all can take pictures of that. I'm not going to try to pronounce all those. You can strategically use HIIT workouts. This can get tricky with women with PCOS. Sometimes women with PCOS also have some issues with cortisol levels that you have to kind of play with. Resistance training, mild resistance training, you have to look at the individual with this. Sometimes they just need to just do walking and body weight exercise. It depends on the individual. And then obviously prioritizing sleep and lots of stress reduction.